Not only does a vaccination reduces the risk of you becoming ill, it also reduces the risk of you transmitting the condition if you do acquire COVID-19. The case today highlights the importance of vaccination. The government will continue to roll out the vaccination opportunities right across the state. We want to make it as easy as possible for every South Australian to get vaccinated. I now ask Professor Spurrier to give us today's COVID-19 update.
Thank you very much, Minister, and good afternoon. So we do have a new case in South Australia, and I was alerted to that earlier today, and it's a man in his 20s, and it's a truck driver, somebody that lives in South Australia, but they go back and forwards to Victoria, into Melbourne, taking goods back and forwards, and it's very important, as South Australians know, that we keep up that freight during the pandemic. But I would like to highlight that he had been following all of the directions. He had been doing his testing every 3 days, and he'd also had his first dose of Pfizer vaccine and was due his second dose this week. I'll give you a little bit more information. It brings our active cases in South Australia to 2. So, as I said, he's a truck driver. He, because of the requirement to do testing, he had a negative test on the 26th, and he's had a test done again on the 29th at Tailem Bend, and that came back as positive. So he had that done yesterday evening, and we had that back this morning. And so that's very reassuring to us that he had a negative test on the 26th, and that we've picked up this as an early positive. And when we do a COVID test, we get an indication from the laboratory about how infectious the person is and where they are in terms of their infectious period. And on the basis of that, it looks like it's very early in the infectious period. Now, one other way of looking at this is, of course, has he passed it on to members of his family or close contacts? And just before coming to the press conference, I had results back for his wife and child, and also grandparents who live in that household. And all of those tests are negative, so that's extremely good news. We also know that this gentleman's wife works in an aged care facility, so we were obviously very concerned if she had tested positive and had been at work in that aged care facility, that we may have difficulties with that aged care facility. So very good news that she's tested negative. But I'd also like to point out that as a worker in aged care facility, this woman was vaccinated, her parents were vaccinated, the child is too little to get vaccinated, and also inquiring into this particular aged care facility, 100% of their staff were vaccinated, and 94% of the residents were vaccinated. So despite that, we will require quarantine for this family, and we're organising that through SA Health at the moment. We have only a small number of exposure sites related to this gentleman, and they are predominantly truck stops to get petrol, and I'll run through those in a minute. But this really absolutely highlights is it's such a good example of when you have people vaccinated, we don't have the spread and the transmission of COVID within our community. And so if you've been sitting on the fence a bit thinking about whether you should be vaccinated, think about the fact that 50% of adults now have had at least one dose. And as the Minister said, by the weekend, we'll be up to 70% for the one dose, and sorry, I should have said 50% double dose now fully vaccinated. So if you haven't got vaccinated yet, you're starting to look like you're in the minority. And as a community, we really need to be moving forward, and this is the way we do it. So just to give you a little bit more information about the exposure sites from this gentleman, there's a BP Roadhouse in Keith, and that was on Tuesday the 28th of September. Liberty Windsor Gardens, so that's a petrol station, on the 28th of the 9th, again Tuesday. Another one on Tuesday was the BP truck stop at Wingfield. I'm afraid that one has been popping up fairly regularly because that's obviously where many truck drivers stop, so that was also on the Tuesday. Caltex Bolivar Gardens on the 28th of the 9th, and then there's one exposure site on Wednesday, the 29th, which was the Ampol Foodery Caltex at Wingfield. So we don't have any further public exposure sites with this case, and I'm very hopeful that we won't have any community transmission as a result of this. But it really does give a very good example of why we need to have full vaccination, and I was very, very pleased to hear about this particular nursing home having that full vaccine coverage. So happy to take questions, but that's where we are with this particular outbreak and exposure. And I should also just note that because this gentleman is moving between states, he is actually now in Victoria, and so he's needing to comply with the Victorian Health Department's guidelines, and they'll also be presumably interviewing him. But I'm very pleased that he doesn't have any symptoms at all, and I'm sure his family will be a bit worried about him at the moment, given that he's not at home with them. And then, of course, my wishes, best wishes to him during his recovery.
Professor, does that, him being in Victoria, diminish his exposure to his family and the potential spread to them?
Yeah, so because he goes back and forwards, he's had a period of exposure to his family whilst he's infectious, so they'll need to go into quarantine. But the really important thing is that his wife's fully vaccinated, and the older people in the household, the grandparents, are also fully vaccinated, so it's giving them perfect protection.
How many people do we think are at these exposure sites?
We're just working through all of the QR codes at the moment. As you know, we've got a standard procedure of pulling QR codes, and I have been really impressed with South Australians using the QR coding at petrol stations. It wasn't a place where many people did the QR check-in, but I think people have understood now one of the major risks for us is the freight industry, as people are coming back and forwards between Victoria, New South Wales and South Australia. So we'll be looking at the QR coding. We also will check CCTV footage and also credit card details. If you get an SMS from us, you need to follow those instructions. These are all listed as Tier 2 on our website. That means that if you have been at that place at the same time, you will need to do the 14 days quarantine and the testing, and to do that immediately. So it's very important that we start to get that testing done, and we will be following up with all of those people.
The aged care facility, is that in lockdown, or are those residents going through extra testing now?
So my understanding was as soon as this woman knew that her husband tested positive, she let her work know. Again, really fantastic that people are understanding the importance of this, and I do understand that the nursing home put in some procedures as a precautionary measure, but now that she's tested negative, there's no need to do that, and my team will be in contact with the aged care facility.
Sorry, so he'd received his first 5 dose and was due his second one?
Yeah. Yeah, so my understanding is he's due his second one later this week, and it's just one of these things it's actually quite a high risk for our truck drivers going back and forwards, and unfortunately with the rates of COVID in interstate at the moment, it's not unexpected, I guess.
Sorry, did you say there was a child, and how old are they? Do they go to school or a childcare?
My understanding is it's a preschooler and they do attend childcare, but again, they're negative, and so there's no need for concern for anybody who happens to have children at the same childcare, and the child's now in quarantine.
With school holidays at the moment, are you advising people to limit travel plans, or just?
No, I don't think so. There's no need to limit travel plans in our state. But I do, I've had a journey to one of our regional centres on the weekend, and I'm just very absolutely make sure that when I go to a petrol station, I QR check in, and I also make sure I sanitise my hands after I've filled in the